I mean, I guess because I was a newlywed, if I'd been married 30 years, I probably wouldn't have asked a physical therapist about it. But here's the bottom line. You have to decide, am I gonna be sexual again?
Pain is one of the least understood functions of the human body. We can't measure pain, and we don't always know why it occurs and what the provocation is, and just as mysterious as sex.
Do I have that desire? Because everything's tamped down, and you're taking drugs. But if you're in a relationship and you love somebody, male or female, you want to give to them a normal life.
One of the things that might have gone wrong is that you may come out of this impotent or some sort of erectile dysfunction. That was a scary piece of the list of things that might have gone wrong.
All the layers of complexity that go along with being in pain and then putting sex into that relationship is so complicated that it adversely affects both relationships, the spousal relationship and then also the sexual relationship.
And your connection, maintaining where our physical relationship it was concerned, it was obviously medication and prescription medication. It affects your performance, it affects your staying power, it affects your presence, just being present in the moment, or even being creative, because there's kind of just one or two ways to do it with a back problem.
When we're dealing with returning to sexual relationships after surgery, or even with a chronic back issue, there has to be exploration that comes into play. No pun intended. You need to be able to try different positions.
But then what was interesting is he started getting frustrated because that was all we could do, that certain position or that certain way, and it's like it was like rote.
Probably 2.5 months. I called the office and I said, I have one question for you. I said, I have all these physical limitations. I said, what about sex?
And a lot of times people get worried about bringing on the pain. They don't want to do anything to bring on the pain, and that inhibits their ability to have sex. And even to get the juices and everything flowing in order to physically be able to perform the act can be very limited due to having pain.
And they said, as long as you're not going to be hanging from the chandeliers or doing something crazy, it's okay. I have been sexually active since 2.5 months after the surgery without any problems.
Well, I do remember when, the point at which we sort of said, hey, let's try this. And the good news was that everything worked the way it was supposed to work. I will say that it was, at that point in time, was probably the most physical thing that I had done yet.
Well, the most important component is patients being able to talk to their doctor about it and it being accepted and okay, that it's not your fault. This is happening to most everybody who has back pain or any type of spine pain. And then also being able to talk with your significant other about it and to be able to deal with it openly and to acknowledge what things cause pain, what don't.
I was a dancer, I could do everything. I was hypermobile. In fact, the reason I had surgery is I was hypermobile. I was too flexible. My gift turned out to be my curse. So when it comes to the intimacies of life, I have to be kind of clever and smart, and you just figure it out, but you have to be really honest with your partner.
Some of those great comfortable positions that you both seem to love, and you just want to surprise her and do something else. And you may pay the price later, but I'd say if you have to pay the price for doing something stupid, that's probably the place to do it, to be honest with you.